Rahul, are you able to figure out how to go live?
Yes, I have done वो एक बार देख लो फीड में आ रहा है कि नहीं because I can see that one. So I can see, yeah, you are there, and so it's you and me in the live feed now.
So one, you have not clicked on go live right now.
I have done that.
आप go live कर लिया?
हाँ मैं लाइव कर दिया go live.
Change that. Fine. So I knew this.
So I'll present on Tracy.
Sure. For people who are viewing us through YouTube, we will go live in another 10 minutes. Request you to hold.
Harika, your voice is low.
Video, is it?
It's a bit low.
Is it better now?
No, it's still.
Is there sure activity?
Yeah, hi Dolly, can you hear me in that live feed? Yes, I have. Huh. Can you? Yes, yes. So I'm just increasing my sound as well because, yeah. And yes, who are there? So it's just me right now, correct? Hmm. Okay. Streaming which is lower than the recommended, it seems. Okay. ठीक है, bro. Cool. Yeah.
Hello.
Hi, Dr. Kuldeep.
Hi, Shubhang. Yeah, voice is clear.
Yes, voice is clear.
Okay.
Harika, are you there? Oh, that's Rahul. Hi, Rahul.
Hi, Shubhang. Hi, Dr. Kuldeep.
Hello.
Hello.
Rahul.
Just waiting for a few more minutes.
Okay.
I think Harika is able to join Rahul, right? Today?
Yes, yes. She'll be the one moderator.
Cool.
How I can change the name?
I think Rahul has used Harika's.
Yeah, Arun has used his laptop to showing Arun
Oh,
Prashant.
Yes, I think it's the login ID of.
yeah. Actually, Harika had some family emergency, Dr. Kuldeep, but he's able to join right now. So we thought that
Okay.
Rahul, but Harika will be here tomorrow.
Dr. Kuldeep, how are things in Jodhpur? Are they getting any better with COVID or
No,
same?
actually, the patients are increasing. So we have now around 150 patients with corona positive, and out of 50% are in the high dependency unit or ICU. So the things that actually now the complicated patients are reaching the hospital.
Oh
Those who
my
are
God.
having mild symptoms, they are having home quarantine, home isolation. But mostly the patient severe illness, they are reaching aims. Basically, they are preferring aims only. So that's why we are getting more admission here. But otherwise, it is okay. It's not very dangerous. And we have called our MBBS student also. So they have joined here. They are undergoing training. Practical examinations are going on. So we are now advising the schools also to open.
Okay, we are live. So thank you so much for joining in, and we really appreciate your patience. We were facing some technical glitches, and that's the reason for delay. I'm Harika Garapati, and I'll be moderating the session today. For all the people who are watching us through YouTube, please post all your questions and comments in the YouTube chat box. We will address all your questions at the end of the webinar. And once again, sorry for the delay. And first of all, I would really like to thank and Invest India, the Startup India team, for all the support that you are extending to us, not only for the innovation challenge, but also for this particular webinar. So we are really thankful for that. And without any further delay, I would now request Ms. Aastha Grover, Head Startup India and ADP Invest India, to give the opening remarks for the audience.
Thank you, Michael, for the warm introduction. Good afternoon, everyone, to the esteemed panelists, to all the startups. First of all, I hope you're staying safe, healthy, and maintaining good spirits in this new normal we're trying to come to terms with. The phrase new normal has become very common in recent times and is being used quite liberally by different economic sectors, which claim to be making valuable contribution to building it. However, in my opinion, among these sectors, the key is the health sector, which is one of and agility in these unprecedented times. The ongoing pandemic has compelled the health sector to make adaptive innovations way ahead of its time, and I'm happy to say that our startups have truly risen to this occasion. Let's take a moment to see how the growth of health sector in India has been over the years. It is no doubt that India is one of the largest sectors when it comes in terms of healthcare, when it comes to revenue and in terms of employment. The market has the potential to increase to threefold to $8.6 trillion by 2022 alone. What is driving the growth of this sector is compelled by new IT innovations and the need to connect everyone digitally. This is also a testimony to the fact that even the healthcare IT market is expected to grow by 1.5 times from the current $1 billion. The sector that we're all very familiar with and we have been using within the health, we've been using this while at home is the telemedicine sector, which is expected to grow leaps and bounds now, given the fact that we're all comfortable now ordering medicines from the comfort of our home, as well as comfortable with taking online consultations, thanks to the tremendous hard work of all the doctors who have made this new normal very common for us. Startups have not been very behind in this growth journey, and this is commendable from the fact that within the last 5 years, there's been almost 50% increase in the funding that has gone to the healthcare landscape in India. With the rising expectancy of life and with the incidences of life diseases, there's no doubt that India will demand for better healthcare services in future. Personally, during the COVID time, I've seen startups come up with some great innovations to support healthcare workers, to support hospitals, and to support critical care equipments. We have seen startups producing low-cost ventilator devices. We've seen startups coming up with innovative Bluetooth devices that could be just attached to the stethoscope so that doctors do not have the risk of contaminating the virus through other sources. We've seen startup come up with affordable, low-cost health devices to providing medicines at the comfort of your home, even in the tier 2 tier 3 cities as well. There's no doubt that the government is committed to supporting this sector, and commendable initiatives have been taken in the recent past. Within the Atmanirbhar package, the special economic package is 20 lakh crore was provided to promote manufacturing within India. And the National Healthcare Protection Scheme, of course, is said to be the world's largest government-funded healthcare program through which India plans to create 1 million skilled healthcare in India. I'd like to laud and commend the efforts of Business Sweden along with the other partners who have come together to support these innovations in the ecosystem. Through this through the Business Indo Innovation Challenge, if you have a solution in assistive technologies or telemedicine or differential diagnosis, especially for the cancer patients, I urge you all to apply for this challenge, which is open till 27th of September. And lastly, I would like to laud all the partners along with Business Sweden, AIMS Jodhpur, AIMS Delhi, the Ministry of Health and Family Welfare, the Government of India, AstraZeneca, NASCOM, Atal Innovation Mission, Agni, Startup India, Invest India, of course, for recognizing and supporting these innovations and providing them the right support. I'm sure through all the efforts, through all the hard work, and through all the recognition that they are going to receive through this platform, the startups have a long way to go in this journey. Wishing all the entrepreneurs, wishing Business Sweden, and thanking all the partners for coming together for this special session. Thank you, everyone.
Thank you so much, Aastha, for those kind words, as well as giving an overview about the startup environment in India. And I'm sure not only now in the pre-COVID scenario as well, Indian startups are always has one of the best technologies that we are there, and I'm sure it is only going leaps and bounds ahead. With that said, I would now request Mr. Amrit Hinduja and Mr. Shubhang Vikas to give us the details about the India Sweden Healthcare Innovation Center. Over to you, Amrit.
Thank you, Harika. Can you hear me?
Yes, Amrit.
So thank you. It's a pleasure to introduce you to the India-Sweden Healthcare Innovation Center. Both Shubhang and me will, over the next few minutes, walk you through what this concept is and what we are about. The India-Sweden Healthcare Innovation Center goes back and rather is built under the umbrella of a G2G relationship between the government of India and the government of Sweden, namely in the form of the India-Sweden Healthcare MOU, that is now in its second decade of collaboration between the two countries, as well as the India-Sweden Joint Innovation Declaration that was announced by Prime Minister Modi and Prime Minister Löfven when Mr. Modi visited Sweden in 2018. And it is from here that we draw inspiration to kind of work with innovation within healthcare. And that's where this collaboration in many ways takes root. It's quite a unique collaboration, we would say. And we're very proud that to have AIIMS Delhi and AIIMS Jodhpur as our partners to this. And this was put in stone, so to say, now in December 2019. The photograph you see in front of you is from the launch ceremony. And I think for us, it's not just a photograph, but it actually signifies a very high level of commitment towards this innovation center and whatever success comes out of this innovation center in the form of the success stories that we hope to create from you. The very presence of both ministers of health, Secretary Health from India and Sweden, among other dignitaries, including the directors of both the AIIMS, stand testament to what we see. And they are all very deeply involved in the progress of whatever we do. And with their support, we have created this triple helix kind of approach where our center, which in many ways is not just a center, but it's going to be an ecosystem. So the word center could be misleading at times, but we are trying to create an ecosystem for healthcare innovation based on the triple helix, including government, academia, companies, and technology, with the patient at the center. And we will talk more to you about that as we go along. I could also mention that when you look at the way we approach innovation, it would be it would not just be technology innovation, but we're trying to kind of broaden the horizon to a more holistic approach, which my colleague Shubhang will walk you through when we talk about our pillars. And I think the overall, when you look at our mission and vision, is to identify challenges in the Indian and Swedish healthcare system and find solutions which are affordable, accessible, and frugal. And hopefully through what we find, we feel strongly we will be also contributing to both the mission of PM Modi as well as one of the objectives of Invest India also here today, which is to kind of make for the world. And we like India to be that powerhouse. And I think all of you who are part of this webinar today, I think can play a very big role if we are able to succeed together in what we do here. And therefore, today, when we launch the Innovation Challenge, this is a way in which we are trying to scout for entrepreneurs, innovators, startups who we could work with in this open innovation ecosystem that we are trying to create. Today, we will invite, when we talk about the Innovation Challenge, you will see that we are inviting startups from all stages, be it early stage, just ideation, but strong ideation, I would say, which are validated to some extent, mid-stage, late stage, and all our efforts will be to see how we can scale you up to a strong commercialization, to a strong business plan. And we hope you will take advantage of what we will announce today, as well as whatever else we offer through this unique collaboration. With that, I would like to invite Shubhang to take the floor to walk us more.
Thank you, Amrit, and good afternoon to everyone here on the panel, and good afternoon to every entrepreneur and innovator who are joining us on YouTube. Amrit mentioned quite eloquently the aspect of holistic and open innovation ecosystem, right? And so what exactly does it mean for us? While conceptualizing this entire India-Sweden Innovation Center, and while looking for partners and partnering up with organizations such as Invest India, we did feel that I think the innovation ecosystem in India is vibrant, has been developing a lot organically, and is focused towards solving problems and creating an impact within India. But one of the gaps or something that we thought that the India-Sweden Innovation Center can also bolster is that how we help these very startups to scale up across India, right? How do we give them an environment which is safe, which can be used as a test bed, where the right kind of mentorship, guidance, and the facilities can be provided under one roof, which is the reason also that we tied up with AIIMS Jodhpur and AIIMS Delhi as well. And you would kind of realize or kind of find in the later part of this presentation that we are creating a state-of-the-art facility at AIIMS Jodhpur, right, which will give you, I can just put it as a one-stop shop of having an incubation space, laboratories, facilities, access to mentors in terms of faculty with Dr. Kuldeep himself here being one of our flagship mentors for the program. And additionally, of course, we do have a state-of-the-art facility at NASCOM also through our knowledge partners, AstraZeneca here, which has a very deep tech lab and a whole lot of digital platforms and support. So that probably kind of is the holistic part of it, and this is the India Sweden Healthcare Innovation Center. So there are definitely some therapy areas which are in focus, but there are 4 building blocks, or I should say 5 building blocks, around which we hope to enable or we hope to drive innovation. We hope to provide support to you entrepreneurs and innovators who are watching us. So the very first one is protocols and processes. So we're talking about patient life cycle, where patient is the center of attention for this entire innovation center. We're talking about how we can improve the efficiency and the effectiveness of awareness, diagnosis, rehabilitation, post-treatment, so on and so forth, so that for both the patients and actually the medical practitioners, the entire act of kind of administrating these protocols becomes much more faster, right? Becomes much more accessible as well. Second is technology. Technology is absolutely an important part, and technology has helped us reimagine both protocols and processes, business models, and the way we use and disseminate data to another level. But I would also like to say that the goal is not to improve technology itself, but the goal is to use digital technologies such as artificial intelligence, machine learning, deep learning, IoT, telehealth protocols, cloud services to better the delivery of the healthcare system itself within India and probably beyond India as well. Third is business model. What can we do to kind of ease the burden of healthcare costs on both the patient and the entire system itself? Fourth is data. How do we best use data, process data and disseminate data to ensure, because data is the base and the bulwark of any improvement that can happen, especially when we have technology involved, right? And also, we intend to create evidence and data from this entire initiative that we have, so that any new solution that comes out that needs to be scaled up is backed up by hard, solid scientific evidence. And the fifth pillar, which probably is not mentioned here, but it is important to mention, is scaling and capacity building. We can create a great innovative solution, but we want to scale it up when we want every medical practitioner to use that particular solution. So we need to train those stakeholders across the board, which is what we will do through skilling as well. And hopefully with all of these 5 pillars, where we intend to drive innovation, we can create an impact across the healthcare delivery, across a big cross-section of our population. Now, if we go to the next part of the presentation, Harika. As Amrit mentioned, we have a concept of quadruple helix in the Swedish ecosystem, where the 4, when we say quadruple, the 4 categories basically are that for any such initiative, we feel it is important to partner up with the right government stakeholders, academia, industry or knowledge and technology partners, and fourth is civil society, which we can probably group your startups in this. So the first is government. It has been mentioned here, but to reiterate, we have Ministry of Health, Government of India, Ministry of Health, Government of Sweden playing a very important part in this particular initiative. Apart from that, we are very happy, of course, with Invest India, Startup and Agni India being a very prime partner, given their network and prowess in innovation. We're also partnering up with Atal Innovation Mission, who have a huge network of incubators across the country. And very importantly, ICMR, or Indian Council of Medical Research, who all of us know are kind of leading the fight against COVID, but they are really strong in identifying and building new protocols and processes, and will be a very important partner for all of us over here. Second is academia. AIMS Jodhpur and AIMS Delhi are our prime collaborators in this particular initiative. And they have opened up their faculty, their right up to the director level, their facilities, to make sure that all your startups get everything under one roof. Third is knowledge and technology partners. We have AstraZeneca with immense experience across the healthcare space, not just in India, but across the globe. And for anyone who has any interest, you would feel that the amount of innovation and activities taking place that AstraZeneca drives across the globe, not just Sweden, but Sweden, China, Brazil, Canada, and now in India for the last many years is immense and truly commendable. And NASCOM with its pure technology expertise and a mandate to drive innovation in the technology space too. And last but not the least, at the risk of repeating myself, startups, you're the core of everything that we'll do. This center has been created to help you ideate, develop, test, deploy, and scale up applications. So with that said, we hope to see a lot more of you kind of asking questions at the end of this session and taking advantage of all the speakers over here. So thank you so much, Harika, and back to you.
Thank you so much, Shubhang, for taking us through the Complete Innovation Center, and hopefully now people watching us would have a better overview about the Complete Innovation Center. Thank you so much for that. I would now request Dr. Kuldeep, Dean Academics from AIMS Jodhpur, who has been one of our core team members and is also part of the Governing Council, to address the audience on some of the healthcare challenges and how innovation could address some of these problems. Also highlighting some of the things that our AIMS Jodhpur and its fraternity is also doing. Over to you, Dr. Kuldeep.
Harika and Shubhang and Amrit and Mr. Gagan and the team from government collaborators and academia. And welcome to the startups for onboarding on this platform to develop the innovations in the healthcare. As we all know that healthcare is costly and it's going to be becoming more costly. But again, there are some innovations which can be we can do in many areas which can reduce the cost of the healthcare. And first of all, we have to understand that the health is taken for a ride. The people understand that it is a free thing. They don't work for it. They don't take care of themselves. And there is a lot of lack of awareness in the society. So one area is that there is a awareness lack, and this healthcare can be provided right from the beginning, from the community or the periphery to the tertiary care center and specialized centers. So this is a continuum of the care, right from the awareness to the screening, to the diagnostic confirmation, to the therapeutic areas, and to the healthy environment in the society. So this is a continuum of the care which the innovation challenge hopes to fulfill. Second is that we have to harness about the technology. So as we can see that when I talk about the awareness, there are many things which we can do in the awareness area. Awareness can be done by whatever is available at our means, but we can also use the technology, digital platforms, telehealth, Internet of Things, and the point of care devices together with artificial intelligence to provide the awareness. Now, all these technology not only help in the awareness, because awareness is one of the most important thing. And when we know that behavior change is required, and for that we have to use a specialized technology, that is the behavioral insight theory or the nudging theory, to bring about those changes in the society. And now here comes the challenge, because not everybody understand or perceive the health same. So we have to develop the innovative model for each and every society. So that means that there are a lot of scope in this area also. Creating awareness with the use of the technology, artificial intelligence, using the behavioral insight models, psychological models, and also understanding the disease pattern. Now, when we talk about like in India, there is a lot of variety of the ethnic regions, cultural practices, communities, linguistics. So one solution cannot fit for everything. So that's why a lot of scope is there for innovation in this awareness area. In the Rajasthan, there are both terrain which are desert as well as the hilly terrain. There are both population who are educated as well as those who are deprived, underprivileged. There are people who are living in a very far distant area where there is no facility for the medical care. So here comes the role of the these technology to enable the people to get access to this technology and also empower them with the knowledge to get this technology to the best of their health for the promotion of their health. Second thing is that we know that there are many diseases. With the COVID, we are now aware more about the coronavirus. I think nobody has known more about the coronavirus than during this time. Now they know about every type of the coronavirus. What is the COVID-19? What are the strains? What are how it diagnosis is made? So there are so many things. But apart from this infection, there are other infections also in our society. Common are the diarrheal illnesses for which we can do the innovations. Apart from this, non-communicable disease are the most important cause of morbidity and mortality nowadays. Even the coronavirus is also infecting those who are suffering already from the hypertension or diabetes. So I think we have to target these areas. That is hypertension leading to heart failure, leading to heart attacks, and also to the screening for the diabetes, which is one of the comorbidity in the COVID. So comorbidity can be reduced when we target about the non-communicable disease, and they don't show any symptoms at all. So that's why screening program has to be done, because we say that the screening are the tests which are very cost effective, acceptable by the society, and available at a very low cost for a condition which is potentially treatable or preventable. So that's why screening is one other area where the technology can be harnessed. Now, not only screening, once we screen the patient and we find out that, okay, this is a patient who is having a likely to be having a diabetes or hypertension, then they subject it for other testing, which are diagnostic or confirmatory in nature. Here comes again the role of the technology, because there is our country lack the resources. So here, what we can do is that we can use the technology for bypassing or using the resources efficiently. So diagnostic is another area where we can go for this technology and innovations. And lastly, when it comes to the treatment are again very costly in the tertiary care. So if the preventive care can be given, we can markedly reduce the cost. So the target should be that the patient should become aware of their health. They should not take it as a free. It should be at a cost. Somebody somewhere else is paying for their treatment. So that's why we have to understand. We have to make aware that they take their proper precautions to get the prevention. Even if they are getting sick, then they should know how to approach the hospital and to optimize the resource which are available in the hospital. So in this area, treatment area, there are many options which are available, right from the simple testing, simple therapeutic options, drugs, pharmacological therapy, medical therapy, or the surgical therapy. Now, again, the surgical therapy, again, the innovations are highly needed, because some of these innovation may markedly reduce the disability which occurs because of the treatment or the surgery. So again, if we can go and think about those ideas which we are seeing in the society, which is causing disabling conditions, we can target the use of the therapeutic models, therapeutic area. So broadly, having a broad picture of the therapeutics, but again, we can concentrate on few, that is non-communicable disease and the cancer. But again, for all these therapeutic area, the thing is that if we can use the technology, digital platforms, telehealth, telemedicines, Internet of Things, combined with the artificial intelligence, which can make the diagnostic very easy, and providing the point of care testing service so that the patient movement to the tertiary care hospital can be minimized. So there is a lot of scope in the area of innovations, and I think this challenge will provide a lot of conducive environment at AIIMS Jodhpur, because AIIMS Jodhpur has around 200 faculty members who are very experts in their area. We have a lot of disease patterns. When you are working here with us, you come to know that, okay, what are the challenges which you are facing? And the real things comes here only, not working in the silos, in the isolation in some other place. but coming directly with the contact with the patient is a one thing, which is this is a AIMS Jodhpur and AIMS Delhi can provide. And I can also show that the IT Jodhpur being at the same place, they are helping us a lot. And you can have the some of the experiments at the IT Jodhpur. So with this, I would like to conclude my talk, but I'm open for any questions which you have, which you want to ask from AIMS Jodhpur team. Thank you.
Thank you so much, Dr. Kuldeep, for beautifully articulating the continuum of care and what are the challenges in the continuum of care that Indian hospital, Indian healthcare industry is currently facing, and also highlighting the beauty that this complete innovation center contains, where we have the live patient environment with AIMS Delhi and Jodhpur, and some of the technology expertise from IIT Jodhpur as well. So thank you so much for that. The next speaker for us is Mr. Gagandeep Singh, Managing Director, AstraZeneca. AstraZeneca for us is a very key partner. And as Shubhang has rightly pointed out, they have been doing innovations across different areas. And we are really happy to have Mr. Gagan himself to present the problem statements and the benefits that the Innovation Center is going to offer to us. Over to you, Gagan.
Thank you. Thanks, Harika, for the opportunity. And first of all, thank you, Dr. Kuldeep, for that very eloquent, problems that today confront our healthcare system, as well as, to Vikas and Amrit for putting the entire support out as well for the program. And Aastha, big thank you for joining us. It's very, very important that we bring in the best minds and together to really take up these problem statements and genuinely try and solve them, and solve them, as Amrit said, in a very frugal, simplified way. But I think the heart of my talk today is then a couple of slides, one talking about problem statement and then the other one talking about what's in it for the startups as well. I think in many ways, the problem statement, when you go through, you'll realize has been defined to identify solutions that can effectively address key public health challenge, and particularly around the non-communicable disease. Be it in oncology, be it in cardiovascular, metabolics, or be it in respiratory. I think we're really pretty much seeing epidemic proportions of some of these diseases in non-communicable disease. And across the disease life cycle, we're looking at solutions which can really make a difference to patients' life, whether it's using technology like AI or telemedicine solutions that will really help in solving some of these challenges and helping improve the outcomes for the patients. I think along with that, education becomes extremely important, especially of our healthcare professionals, as we've recently seen ourselves with the challenge we're facing in the pandemic. It's not just about managing COVID, but it's also about managing the comorbidities, or at some point of time, just managing patients who may not have COVID, but are still suffering from, having access to some of the treatment paradigms as well. I think overall, pretty eloquently and sharply defined problem statements are available on our website, indiaswedenic.com, and I would urge all of you to really look at it and see if some of your solutions can help, solve some of these problem statements. In terms of next slide, please. Benefit for startups. Our endeavor has always been to offer promising startups the avenues to showcase and explore getting successfully implemented in markets beyond India as well. And I'm glad to share that, while one of our winners from last year's challenge is now presently part of a project which is spanning 10 countries, and another one has successfully set up operations in an international market as well. So, we have an entire ecosystem, and hubs out of Sweden, Russia, and other countries as well, Taiwan, where similar attempts are being made, and we could link you up to some of those as well. I think mentorship is really important. We do understand, and the ecosystem of partners are like having AIMS Jodhpur, NASCOM, Business Sweden. really takes mentorship to the next level, and having these renowned industry leaders and faculty, I'll really urge you to make the best of this. Funding is always the critical part of it, and there are wide array of investors which are available, PE funds and others, which will be participating on the platform itself, and you'll have the opportunity to network with them. I think one of the most unique opportunities this provides is the incubation, which is access to deep tech laboratories. As an example, the patient environment in AIIMS Jodhpur, where the physical center will come up, and I think that's quite unique. And along with that, there is a center of excellence in Bangalore, and you can have access to NASCOM capabilities which are there, IoT driven, or 3D printing and other are available there as well. So I think make the most of it. This I potentially is the really the aha of the offering that we have. And apart from that, obviously, like I said, partnering with Business Sweden and partnering with AstraZeneca in many ways helps, in terms of global reach as well. So all in all, really excited. I wish you everyone a big luck. I think you've got a great opportunity here, and we look forward to hearing from you.
Thank you so much, Gagan, for highlighting it so beautifully, the benefits that we're going to have offer to this particular platform. Now, I would go on to the timelines of the particular innovation challenge. So the applications are now open. We launched the innovation challenge in the last month, and we will be open to accept the applications till 27th September. We'll go through all the applications will go through a rigorous evaluation process, and the winners for the platform will be announced on 25th October. So I would urge all of you to apply to the innovation challenge right away instead of waiting for the last minute to apply to the innovation challenge, just to avoid any technical difficulties. Thank you so much. With that said, we have a lot of questions from all the audience. Again, very interesting questions from multiple people. I'll go as usual with question by question, and we'll see how we take it. So the first question that we have as part of the current webinar is the application only for startup or other companies also eligible? Shubhang, you want to take this?
A company means a lot of things. It depends on what you're doing. So again, I think it has been highlighted by some speakers. The solution should be fit and should be frugal in nature, which will create an impact, right? I would urge you to kind of look at the all the problem statements, and we definitely want to focus on startups, right, which are from early to scale up stage. But having said that, we would love to see what you are doing and if there is a fit towards any of the problem statements.
Thank you so much. The second question that we have is, we have a project in the market that will also be eligible. We work on public health and launched an e-hospital 2 weeks back. So can we apply for the innovation challenge? Dr. Kuldeep, do you want to take this question?
Yeah, definitely. Actually, e-health has become a very important concept nowadays. Everybody is knowing about what is telemedicine now. And the concept of the telemedicine can be applied for the electronic health also. With the National Digital Health Mission being launched on 15th August by our Honorable Prime Minister, this opens up a lot of areas and vistas to be explored for the exploration. And I think this is a one area where we have to need to understand not only the technology, but the end user. So what we found is when we talk about the e-health or telehealth, we dissociate from the health and talk much about the electronic part, digital part, or the tele part. So we discuss about the technology, and what we have practically seen, the patient are not concerned with the technology. They only want that their cure or the treatment or there's some compassionate understanding of the disease. So that is least explored throughout the world. Now, in the Western literature also, it says that we have to learn more about the patient, what they actually want, what type of things they want. So I think this is an area which is very important in India because of the remoteness and because of the non-availability of the facility in many places. So if we go for the end user acceptable things, then I think this will be very good. This is a very good area, and a lot of scope and lot of options are there. We should not talk about only the like regulations, because in US also, in UK also, they have relaxed the regulations. We should not talk about the regulations, because each and every regulation increase the cost of the treatment to the end user. So again, we have to think judiciously how we can maintain the things and also provide the therapy and the e-health to the community.
Thank you so much, Dr. Kuldeep. Okay, the other question that I think you also already addressed is, we have a telemedicine solution. Can we apply? So I think yes, you can apply for the apply through the medicine challenge that we have. So okay, this is again to you specifically, Dr. Kuldeep. Could you shed some light on some projects within AIMS Jodhpur where AI and machine learning has been used extensively?
Yeah, actually, there are many areas in which the AI can be used. Machine learnings, from the simplest form, is the use of the conversational agents or chatbots. To the more complex is another area which we are working on. That is the digital twinning. Digital twinning is a new concept in which there is a lot of modeling requires to be done. And with the help of Internet of Things, biosensors and sensors, so machine can learn about each and every patient as an individual and replicate the same thing in the hospital. So in a hospital, when you're remotely monitoring the patient, you have the whole of the data base of that particular person. So again, this is known as digital twinning. That is that whatever happening in a particular patient A can be replicated in our computer system. Similarly, what is happening in B can be replicated. So there are thousands of patients has each having different data, and which use of this data we can provide a personalized or precision medicine. And one of the area which is very useful is heart failure. A heart failure patient, after surviving from the cardiac arrest or cardiac infarction, myocardial infarction, and these patients usually go into a area from the mild to moderate or severe heart failure. So those who are having a severe heart failure, they are always hospitalized. But those having a mild to moderate, but they needs a continuous monitoring, which is not possible in the hospital setting. So here the scope is there. We can develop the digital twinning devices, digital twinning models, use of the Internet of Things, sensors for remote monitoring. At AIMS Jodhpur, we are doing in this area. And secondly, what we are doing is that in the OT, operation theater, when the patient is being operated among the brain, which is a very important area, and the surgeon does not know from physical examination what is the area he's touching on. So with the neuromonitoring, the neuromonitors can monitor that, okay, whenever that particular area is touched and released, their signals are generated, and the immediate information is given to the surgeon that, okay, they have reached that place. So in that way, we can minimize the trauma to the other tissue in a delicate part like brain or in the pelvis or in the heart. There are many areas which is known as peri-operative monitoring. Here also the artificial intelligence may be quite useful. And there are other areas also in which the AIMS Jodhpur is working on.
Sure. Thank you so much, Dr. Kuldeep. The other question that we have, in fact, is, can we get market access opportunities to Sweden and North European markets? Gagan, would you like to take this question?
Yeah, I mean, one of the things we see with a lot of digital solutions is that it has potential to go across the boundaries of the country, and therefore this potentially can offer opportunity to be mentored. If the solution is really strong and good and can help any other country or economy, absolutely, there's an opportunity.
I could also maybe highlight and just add to Gagan over here that we have a specific area that we were supporting called Global Reach as part of our support to startups. And So, and that is particularly designed to use the expertise we have at the Trade Commissioner's Office to promote exports. And we have 50 offices across the world, including in some of the countries you mentioned. And therefore, one mechanism that we have set in place is a structured way to actually help you go out to other markets where your product solution could be applicable.
Thanks, Amrit and Gagan. The other question that we have is, does the or can they apply equally? Amrit, can you take this question as well?
Sure. So this is not a joint call for application between two partners of two different countries. This is an independent thing. So just as you as an Indian company or as an individual can apply. So no matching process required.
Thank you. We have a startup in IT who is working in early cancer diagnosis. Do we have to collaborate with AIIMS or Jodhpur, or can we independently apply for this? I'll ask Shubhang and Dr. both of you to address this question.
Okay, so I think again, just reiterating what Amrit just said, AIIMS, Jodhpur, and Delhi and Business Sweden are collaborators, right? The solution development would be owned by you, the individual or the startup, in any of the areas that you're applying. So when we say that we are inviting you onto this collaboration platform, it's a mechanism. It's a one-stop shop for you to get incubation, access to facilities, access to labs, access to mentors, funding, market access to other countries and within India, and a whole lot of other things. So you do not necessarily need to collaborate specifically with AIIMS, Jodhpur, and Delhi. However, because you would be on this platform, it will only be beneficial for your own product if you involve faculty from AIIMS, Jodhpur, Delhi, and our knowledge partners in developing a solution to make it market ready, to make it scale up ready. But Dr. Kuldeep, do you want to add more on the subject of the startup?
No, I agree with you, Dr. Shubhang, that the candidate or the participant has to look into area in which he want to do the work, find out whether this facility is at AIIMS Jodhpur or Delhi, and all the other technological institute, and they have to develop their model. But as part of the startup and incubation center, AIIMS Jodhpur is ready to help in whatever areas, and sometimes we find that it is easier to do a work with the faculties who are available and who are ready and they are tuned to that innovation development.
But I could maybe just add, you'll have your total independence in the way you operate. We are here more to provide you a support and a mechanism to move faster from where you are today to achieve your goals. And then that is using this ecosystem that we have.
Thanks, Amrit, Shubhang, and Dr. Kuldeep. Okay, we have another question with respect to I have a digital innovative idea about the whole medical infrastructure in our country, but I need an experienced mentor and an organization to tie up and grow. So I think if the question is, do we have it? If you could address in a similar manner, Amrit. Yeah.
Okay, maybe I will say, and then I will invite Gagan to actually add. It's also related to something else we spoke yesterday, another similar question. But essentially, we, of course, inviting ideas, but the idea should be strong enough. We will not be able to kind of help you kind of fertile the idea. You should be strong on the entire concept itself. And of course, then we can mentor you and support you to kind of scale up. Gagan, maybe you want to add. Very similar to yesterday.
Yeah, again, I believe one part of the whole exercise is that you are benefited and learn the most and make the most of the opportunity that's available. And sometimes just having a good idea may not be the best route there. If you develop it into a prototype or a quickly one, then you can. I mean, like, for example, you've got a lab available in AIIMS Jodhpur or NASCOM, and therefore you want to make the most of that. You need something which is on the ground and can help rather than thesis alone.
Thank you. Okay. how do we proceed if a startup can address more than one healthcare challenge? In the interest of time, let me. So you could apply for multiple challenge statements, and in the Startup India page, you could. There's an option to apply to multiple challenge statements, and we will evaluate it across all the problem statements. The other question that we have is preventive and predictive health for NCDs with the purview of the program, within the purview of the program. And they have mentioned the details of the startups. Gagan, do you want to answer this question?
Yeah, I mean, our focus is towards NCDs, and we're looking at solutions both, which could be preventive in nature as well as which could be more outcome oriented as well. The idea behind focusing on specific 3 or 4 diseases is basically because we felt the disease burden is very, very significant in this country. And that's why I mentioned about these 3 therapeutic areas: cardiovascular, respiratory, metabolics, as well as oncology. So I think it's really important that we keep it to the problem statements. We keep it focused towards that. Within that, yeah, I mean, there could be various evolution stages in a disease journey that you can address.
Okay, we have 2 questions. One product is addressing the hygiene and safe delivery for mother and newborn. The other company is specifically into the natural nutrition company. So I'll ask both Dr. Kuldeep and Gagan to address this question. Can we apply to the innovation challenge for both these type of companies?
Yeah, definitely. Because this is an area mother and child newborn occupies a very huge portion in the mortality and the health in the country. And there are specific innovations which are targeted toward the mother and newborn will be highly influential for the country's growth and development. Because we see that there is a 38% infant mortality rate, still very high for the children, that is they reach up to first year, and that occupies 38%. Out of this, the maximum mortality occur in the first month, and out of this, the maximum mortality occurs in the perinatal period. And the most important cause of this is birth weight babies and the premature babies, and the third is the sepsis and the pneumonia. But apart from that, the most important cause is the maternal health, maternal nutrition. If the mother is anemic, if the mother is not educated, she will not be able to take care of that. So one of the important concept in which one can work is 1,000 days of the life. 1,000 days means that the 70 days inside the uterus in the womb, and 365 days outside. So that is 2 years, first 2 years. If everybody start targeting about these first 2 years, I think we can reduce many of the health problems. We know that the mother nutrition get imprinted on the baby, and it ultimately leads to diabetes in the adults, hypertension in the adults, stroke in the adults. So if the baby is undernourished in the intrauterine environment, even if you correct the nutritional abnormality, the baby continue to behave in that abnormal imprinted metabolic behavior. So that leads to the disease or onset at an earlier age. Rather than 60 years having hypertension, the child or the adult will become hypertensive at the age of 30 years. So this is an important hypothesis which is known as the Parker hypothesis. It has been proved, but there are many innovations can be done in this area to target in the mother and newborn health. And again, the nutrition. These 3 things are linked together to the non-communicable disease also.
Yeah, nothing much to add from my side. Just additionally, go back. There are significant problem statements. Read them through, and then you can also respond to them differently as well.
Thank you. Okay. The other question, I think it's an interesting question, is we have developed a first hand-cranked defibrillator which works without grid electricity and costs 1/3. Is this something in line with the call? Shubhang, do you want to take this?
I think Gagan or Dr. Kuldeep should kind of probably, but prima facie, yes, it kind of seems very interesting. And just for the last question also, I think apart from what Gagan mentioned, that there are specific therapy areas, there are For the mother, for that particular challenge that you said, there are other problem statements also, which is, if you're kind of creating a decision support system or you want to kind of create data, you can definitely apply. Defibrillator, hand crank sounds extremely interesting to me, but I will let Gagan and probably then Dr. Kuldeep kind of also talk about it.
So yeah, as I said again, it can save many lives. And those are the kind of solutions we're all looking forward to. And like Shubhang said, really excited.
Thank you.
I agree.
Okay.
No, so I think the end answer is that yes, you should apply. Please do apply.
Yes, Mr. Ashish Gowda, please do apply to the Innovation Challenge, and I think it is very much relevant to the statements. Okay, couple of questions. I think in the interest of time, I should combine multiple questions. We are a startup incubated in other location. There are questions with respect to IIT Bombay and others, but can we still apply to the Innovation Challenge? Amrit, can you take this?
Absolutely. So, but you could be already be sitting somewhere else, already been incubated somewhere else, and that's of course absolutely fine, because that's the way you've been growing so far, and you can definitely apply. You need not physically be with us at our incubation center to be part of this collaboration, so to say. You could still get the benefits of all of it. However, of course, very naturally, if you need to be in a live patient environment at AIIMS Jodhpur, which if they help create, or if you need to be at the labs, then you might have to, at some point when things open up more and more safe, you might want to come over and sit with us, etc. So we are creating all these enabling factors for you. And it really depends what you need. And if it means that you need to go physically be somewhere with us, then we would kind of suggest that, and then you have the possibility to avail that. But you could be incubated somewhere else, and you could still apply, and if you're win, you could take benefit of this opportunity we are providing.
Thank you so much, Amrit. I'll combine few questions now, more with respect to the administrative questions. One is, I'm a startup, but at an idea stage, can I still apply? And how can you support in funding and networking? And will you be able to support us with the right ecosystem? I think I'll give the floor open to everyone to answer if there is anything missing, starting with you, Shubhang.
Ideation stage, yes, but as I iterated, it cannot be just a brand new idea. It has to have gone through a certain process of germination, right? So that you can actually take advantage of the labs and the real world patient environment or that we are providing. Secondly, funding and networking. We have tied up with the private equity funds and venture capitalists. And also, we will enable access to government grants and funding through our government collaborators, and of course, through AIIMS Jodhpur and AIIMS Delhi. And third was networking, I believe. Yeah, and as you can see, the participants and the speakers that we have here, we are being pulled from multiple different organizations, both government and private sector. We have many ecosystem partners across both government and private sector, as was highlighted earlier. So it will be an opportunity for you to leverage these networking at whatever stage of maturity of startup you have, right? So if someone needs to scale up, then we have the right partners for you to kind of talk to, the funding agencies and maybe the regulators to kind of see if your particular solution complies with the laws of the land. If you are at an ideation or a mid-stage state, then you require more mentorship, that we have through the faculty of AIIMS Delhi, Jodhpur, AstraZeneca, and us Business Sweden, apart from a whole lot of other partners. Yeah, that's what I would say. I don't know if Amrit or anyone else wants to add anything.
Gagan, do you want to add anything?
No, I'm good. I think very, very well articulated.
Okay, so I'll go on to the next question. This question is to Dr. Kuldeep. Preventive health models require a lot of regulatory changes, per se IRDA regulation changes. Can this forum address such concerns?
No, preventive aspect comes under the public health. And only thing is that when we apply to the public health, the regulations are a little easier, because then we have to take permission from the regulatory authorities for doing large scale studies. But again, the thing is that we have to rope in the other people, like stakeholders, the local religious people, ethics committee, the drugs companies also. So then it may slightly, but otherwise preventive is promoted. Preventive actions or preventive innovations are highly the need of the hour. And I think they are not stoppable at the level of regulation. You can start at one area, can move and then show the data to the higher authorities, which will work. So they will approve. So again, if it is going to help the society, uh, in that situation, it is not having any foundation toward the regulation.
I could maybe add here a bit to what Dr. Kuldeep said. Uh, so the way we are structured, if you see, it's we have AIMS as our core partner, and one of the objectives of having AIMS institutes across the country is to identify new ways of delivering healthcare across the continuum of care. And therefore, one of the objectives that we have here is that when we find a certain type of solution, now, of course, you're speaking preventive, but anywhere in the continuum of care, and if together we are able to create the right success stories that are science based, fact based, then this is something very much of the interest of partners like AIMS to kind of promote that at a policy level, at a central government level, to say that maybe this should be considered as the new way of doing something in the country. And even in our governing council, we have the Ministry of Health of the Government of India and Sweden and ICMR. And their key role in this is to kind of help us set this vision, but to keep tab of these success stories and see, is there something great coming out of here that we can actually transform the country with, so that we can have a top down effect. And of course, this sounds very promising, but it requires a lot of effort and from both our sides. And this is our kind of slightly longer term vision that we have and the strength that we bring on the table with the stakeholders we have.
Thank you so much, Amrit. In the interest of time, I'll take the last two questions. Sorry that I couldn't take all the questions, but if you have any queries, please feel free to reach out to us on the credentials that we have shared on the screen. And the last two questions are, we are into a solution for hospital costing analysis decision support tool. Are we eligible? Dr. Kuldeep and Gagan, I want both of you to answer this.
Yeah, actually, AM Nupur is also a part of the Health Technology Assessment Hub. So we are doing the costing analysis also for anything like ranging from the services to the diagnostics to the tools to the procedures, which are helping everyone, like the public health also, which are helping the surgeons to do the surgeries, which are helping the general public to get the diagnostic tests done. And what is the utility of this diagnostic? And I think innovation in this area is very much the need of the hour. Again, these are the some of the innovative ideas, innovative areas where the country needs more of the inputs and some demonstration model which can prove to the government that okay, this is going to work and it will reduce the cost. So they can be supported, and Dr. Gagan again can add something on that.
Yeah, no, you're absolutely right. I think health economic models can help both ways, can help in sharper and better decision making, as well as in genuinely comparing treatments and outcomes with the impact it has and the burden it has, and therefore I think under the decision making and help this problem statement can fit into. So you're absolutely right. Very helpful if someone develops some of these.
Thank you, Gagan and Dr. Kuldeep. One last question for us is, do we need to be a profitable company to win the challenge? If we're outsourced or a company project, does it weaken our stand in winning the challenge? Since it's the last question, I'll open the forum to everyone. Gagan, do you want to start answering it?
Yeah, I didn't actually get the drift of the question. Maybe.
So the drift of the question is to get selected into the innovation challenge.
Yeah.
Do we want? Does the company need to be profitable?
I mean, that's a I mean, we don't have any condition that I know of, anything like that. We're not going to be judging from that perspective at any point of time. I don't know, Shubhang or Amrit, what's been your long-term experience also?
No, just to add again, in the sense, see, I think we have talked a lot about market access and scale up. The idea behind this innovation center is truly to kind of make an impact and a difference. Our aim is not to make anyone profitable, none of us, neither the startups who come here. We will give you all the tools you require to be successful, right? And as a byproduct of it, if you happen to sell your solution, we'll be happy for you. So, no, you need not be profitable at all, right? And I mean, most of the startups are not. I'm assuming most of you will not be not. But yes, you can.
Yeah,
You don't
yeah.
need
It's not going to be a selection criteria for sure.
And I also agree that sometimes on the face value, it appears to be not very profitable idea, but it happens in the past with the disruptive innovations, which have changed the complex things to very simple things and enabled the life of the life of the people. The examples are the simple mobile phone, which has now changed the life of the people. Similarly, innovations can be there, which may later on become quite profitable. At the face value, they may not be profitable at the time when you are thinking about those ideas. So I think it is, as Shubhang, Dr. Gagan, and Amrit also said, that we don't discriminate about the whether they are profitable or not. It is up to you how you make it and how you can sell it out. Any startup may later on come out to be very useful for the society. That is also a profit.
Yes.
Thank you so much, Dr. Sri, and everyone now for articulating the question very rightly. I'm not taking any more questions, but if you have any further questions, please reach out to the coordinates shared in the screen right now. You have been really fantastic audience, and all your questions really excite us. I would urge all of you to apply to the innovation challenge and go through the challenge statements in detail. And if you have any questions with respect to the challenge statements, please contact us and we'll be happy to take all your questions one-on-one. So that being said, that's the so we don't have anything else to present. So thank you so much for joining in, and stay tuned with our website to get any more updates. I would request all the speakers to hold on for one more minute to take a screen grab. Rahul, stop sharing the screen so that we can share the screen. Jayashree and Pradnesh, can you switch on your video also, please?
We're not speakers, though.
Okay, Jayashree. We can still have you.
Yeah, Pradnesh, we can have you from the. Yeah, good that the Thank you, Pradnesh, for joining from the consulate in Mumbai.
Thank you, thank you. It was very nicely organized.
Yeah, thank you. Okay, I think is that Rahul left over there?
So I think it is good with the face mask. It's okay.
That's okay, sir. Yeah.
Okay.
Thanks, Rahul. Yes, we have done it.
Thank you.
Okay.
Thank you so much, everyone, for joining in.
Thank you. Thank you.
Thank you. Take care.
Everyone, bye-bye.
Bye.